and welcome to Rogue Voice, conversations that inspire and connect. I'm Tiffany Cooper.
And I'm Jessica Gomez. It has been, 6 months since the U.S. got hit pretty hard with COVID-19. Governors across the board started shutting down schools, restaurants, large gatherings. And we thought maybe during the summer we'd see a little bit of a let up, and some areas did. But I think now as we head into the winter season, so it's September, I think that we're starting to sort of prepare a little bit more for what's to come.
Yeah, I agree. I'm here in Minneapolis, and we have a surge of cases. We were on this really steady Eddie with our cases, and we've just had increases this summer. And so I guess our governor and our mayor, we have decided to do a hybrid when it comes to going back to school and for colleges and school kids. And so it's just been this controversial of what to do. But we have two very important guests joining us here today to talk about the challenges of managing a regional health system in this time of crisis. Please let me introduce Scott Kelly, the president and CEO of Asante Health System, Dr. Jamie Grebosky, Chief Medical Quality and Medical Officer of Asante. Please welcome both to the show.
Hello.
Thank you. Hello.
Yeah.
Thank you. Thank you for joining us here.
Thanks for joining us today. I think this is something that so many people have talked about. When we discuss bending the curve and why we're putting so much effort into sort of making sure that we don't see those big surges. And one of the reasons is that we don't want to overwhelm our hospital systems. And so we just really appreciate you coming on the show to talk about this important issue. Scott, I'm going to start with you. Could you talk a little bit about your background in healthcare and how you found your way to Asante?
Sure. Be happy to. So I've been at Asante for almost 21 years. So I've been in Southern Oregon for a long time. Started as a strategy officer, actually was chief operating officer, CEO of Rogue, and now president and CEO of the health systems. So I've done a lot here. Prior to this, I was in California. So I was in Central California, and then prior to that, I was in Dallas, Texas, in the strategy realm for most of that time in Dallas and California. But really having that strategic background paired with operations has really made me prepared, I think, to take over the leadership role at Asante, and born and raised in Wisconsin.
Yeah, one of the things that I love about your background is that you know our community so well. I mean, you've been here a long time. I really appreciate the perspective that you bring. It's so important to have that. We're still a small community, even though we're growing.
We
right?
are. Yeah.
And so thanks for being here and for taking on that role at Asante.
Yeah. Happy to.
Yeah.
Yeah. So I want to ask you, Jamie, could you tell us about your current role at Asante and how your background as a family medical specialist informs your work that you do?
Sure. Yeah, great. Thank you for that. I'm Jamie Grebosky. I'm a family medicine physician, and I'm Chief Medical and Quality Officer at Asante. And, really my background was as a practicing doc. I was a clinician for many years practicing as a doc. I had the unusual circumstance where both my wife and my mother-in-law were PhD and master's trained in human factors. And both of them worked for the healthcare system where I worked. They were in the quality department. And so I was always a guinea pig for their sort of mad scientist projects around quality and safety and all those kinds of things. So I was always the person that they would pull in early to do that work. And it just sort of seemed interesting to me, right? As I had to live with it at home with my mother-in-law and hear from it, all the time from her. And so they started pulling me in, and it sort of became part of my daily work over time.
So in some ways, I guess it's like this work is in your DNA, as you will.
Yeah, I just see it inexorably tied to the care myself as an individual delivers, and that we deliver at Asante on a broader spectrum. And so it's the difference from a individual physician dealing one-on-one with a patient and a healthcare system dealing with, thousands of patients and hundreds of thousands of community members in a community.
Mm.
I was telling Scott earlier that title that you have, quality, as it relates to medical care, I find it's like so scary. I mean, the responsibility that you have to the hospital system and to all of us in the community, that's pretty daunting. Do you feel that?
Well, I'll tell you, no. I think, the kudos to Scott, kudos to our physicians, our providers, our nursing staff, everybody who works at Asante. We're a very high quality facility. You may know all our facilities are CMS 5 stars. All of our facilities do better than high levels of national average on everything. And so it really makes my job easy. It's part of our organization, like it's part of my DNA, it's part of our organizational's DNA to make sure that we provide high quality, safe services to our community. And so it really makes my job easy to do that.
That's fantastic.
I love you say it with such ease too.
I know.
It's like, oh, it's not obviously you can tell the influence of your family, give you that confidence, being raised in an environment that supports, your mission, really, your life's purpose.
Yeah, I mean, as an individual physician, as a healthcare system, nothing is more important to us than making sure that we're improving the healthcare of that individual and that community. That's why we exist, to provide these services. And I'm glad we can demonstrate to the community we do that in a transparent fashion and really against every other healthcare system in the country. It's one of the reasons why we're one of the top ranked healthcare systems in the country.
That's excellent. I mean, as a patient, that's what I want to hear.
So let's talk about COVID and what we've got planned in the case that we've got those surges in cases that everyone's worried about. Scott, can you talk about what Asante Health Systems, what that plan is that might be we all hope that's in place in the case that we go back to, let's say, a stage 1 shutdown to impact your work as CEO?
Yeah, I mean, I think the first thing the publics need to understand is the governor has divided us into regions. So we're in Region 5. So it's Asante Hospitals, Providence, and the hospital in Gold Beach are all in one region. So we keep track together of the number of beds that are available, the ICU beds that are available, the med surge, preparing for if we ever have that surge. Now, the good news is we haven't seen that. Actually, we're at a low point of hospital admissions now than we've been in quite a while. But we do have those beds available should we see a surge. So I have the utmost confidence if we do have a big surge in hospitalizations that we'll be able to handle it as a region. The other thing that really is important, I think, for us to talk about is just that Asante is that coordinating entity. So the state has made Rogue Regional, kind of that regional coordinating entity to make sure that we have capacity available. But we've been working very well together here in Southern Oregon.
So you mentioned hospital cases, like the hospitalization rates going down. So, and I've read a little bit about this, is that trend may continue as cases go up. Are you seeing the same statistics?
Well, we are, and I'll let Dr. Grebosky, maybe he would be more eloquent to address that from a medical side, but we are seeing the cases in the hospitals continue to decrease. And we just haven't had many hospitalizations, even though our volumes of positive cases have spiked on the outpatient side.
Yeah.
Why do you think that is? What is your thought?
So this is Jamie. I think we've seen a little bit of a shift in the pandemic right now to a demographic that is a little bit younger and healthier. So a lot of the new cases that are coming up are in the younger, healthier population who are less at risk for serious complications, not at zero risk, right? We know that this is a serious illness for people to acquire naturally. What we've seen is as that demographic has shifted and as more younger people have acquired the illness, less older people and less hospitalizations. Now, I think there's an important lesson in there, because some of the things we have seen is that what happens is a younger, healthier person acquires it, but will bring it into a household with an at-risk individual. And then that at-risk individual ends up being hospitalized or at serious risk.
I see that. Well, I like to piggyback off of what you're saying. Could you, Jamie, elaborate a little bit more on how concerned should communities be about the sudden uptick, in cases this winter? Are hospital systems still at risk for being overwhelmed? I mean, going forward now?
You know what? I think the most important thing I've learned from this pandemic is we just don't have all the answers, right? We're still learning about this pandemic as it unfolds. I do think there's cause for us to remain wary and to continue to educate the community about things like physical distancing and mask wearing. And that's one example of something we didn't understand at the beginning of this pandemic. We didn't understand the capacity for an individual who wears a mask to prevent transmission of this disease, right? We did not have the data and the information. I looked at the CDC website maybe a month ago in preparation for a talk I was giving, and all of the examples for the masking were in a 4-month window. All of the articles there were recent, right? We just simply didn't know the answers to this. And I think that's, so I'm going to tie back to your question. I think that's an example. We don't know all the answers. So I think, yes, we are prepared. We've done everything we can. We have beds, ventilators, knowledge that we didn't have before, resources, supplies of PPE, and yet this pandemic can still throw us curveballs that are unexpected for us. So we are not out of the woods by any means, and this winter we'll have to remain vigilant. And the thing I would say is our community can help ourselves. We can help ourselves. Maintain physical distancing, wear masks, engage in appropriate hand hygiene, those sorts of things. If you're ill with respiratory symptoms, call one of the triage lines, get a video visit, make sure you're isolating, regardless of whether you're testing.
Well, I hear the main thing is as someone who tries to stay healthy, it's just we have to be vigilant. We can't let up. We really can't. And I think that's what's hard is for those who are trying to stay well or those who've been sick and recovering, the sustainability of just trying to stay on course and not let up and get sloppy, if you will, which I think that is a thing that I'm seeing. People are getting restless, but and getting careless. And so I think that's a thing that we have to continue. Do you agree?
I absolutely agree. I see it in our healthcare workers as I round. People say, I'm tired of wearing this mask and this face shield and all these kinds of stuff. And I understand. I am as well. You see Scott, myself and Scott from our home environments because we are physically distancing. And it is challenging, but it is important for us to remain vigilant. Until there's an effective vaccine out there, we're going to have to continue these sorts of efforts, I think, because we won't be able to get adequate levels of herd immunity without serious repercussions for our society. So we need an effective vaccine really to sort of break the cycle we're in. Right.
Yeah, it's interesting to see sort of the progression over time. At first, people, felt weird about wearing a mask, even though, everyone knew that it was important. And I feel like we're kind of over that now. And yet you see, sometimes there's a little bit of complacency that you can get when things are going well. And, in the very beginning, everyone was very aware of when they were touching their masks and things like that. And now everybody's wearing them all day, every day. And I think, there's also an additional risk there. Scott, I want to ask you about the different strategies. I mean, the Asante hospital system and medical system is rural, and we have some urban areas. Talk about the difference in strategy between urban and rural.
Yeah, and the strategy has been for us has been to really act as a health system. And so we've really tried not to have the individual entities, whether it's Rogue or Three Rivers or Ashland, act on their own. And we've really tried to make sure that we're using the best of the resources available at each facility. So when we have a critically patient that needs critical medical care, you'll find them at Rogue. You know, if they don't need the critical medical care, you'll find them at Ashland, that type of thing. So we're really trying to act like as a system. Now, telemedicine has become sort of a mainstay for us. I mean, we did about 10,000 telemedicine visits a month. And we don't expect that it will stay at 10,000, but it's not going to go back to the low numbers it was at. And so we are starting to see physicians, and we're starting to really push treating people post-hospitalization and even pre-hospitalization using that technology. We were the first health system in the state to have a drive-through testing facility, and so you could get your specimen taken at a drive-through, and now that's become sort of the mainstay in the United States. But we were the first ones, so having the ability to get a video visit is really very important, especially because, you know, you don't want to give this to somebody else. As Dr. Grebosky said, it's really easy to transmit this disease to somebody else. And so what the last thing we want is them walking into a place where there's a lot of people. So this drive-through thing makes a lot of sense for us.
Well, that's interesting you say that. I want to speak on this. Jamie, maybe you can elaborate a little bit. Could you talk a little bit about the COVID testing resources, just to piggyback off of Scott?
Yeah, so as your viewers know, testing has been a challenge nationally, and we're no different. But we have taken a leadership role in our community to acquire and validate and have testing platforms. We've got multiple testing platforms available at Asante, and we utilize those on a daily basis. Now, the supply chain for acquiring reagent for that is still somewhat unreliable. So on a daily basis, we have to shift our testing depending on what reagents we have, what supplies we have, and those sorts of things. I think testing is absolutely critical. We're not where we need to be at this point in time, and I would encourage folks who are symptomatic to get a video visit, get a test ordered, make sure that they're isolating after that test until their provider or physician tells them you're out of the period where you need to isolate, depending the result.
So, question about strategy around testing. I know in the very beginning it was hard to get approved to receive this test, and I have a 9 and a 6-year-old, and just recently my little 6-year-old she got a cold, but you know, you look down the list of the COVID symptoms. Of course, you know, the first time when she got sick, we were like, oh no, you know, what did she touch? We looked down the list. She looked like she had like every symptom, right? And so we got a telemedicine visit and got her tested. And I have to say that that process was so smooth. I mean, we drove the same day. We got the results. She was negative, which we were really thankful for. But you know, there's going to be more and more of that, I would imagine, as we head into fall. Even people who have sort of what appears to be a common cold, there's a lot of anxiety about whether or not that is an actual sort of, you know, a slight presentation or a moderate presentation of COVID. Can you talk about, should people just be getting tested for everything?
Yeah.
What do you think about that?
That's a great question, Jessica. And the challenge is the symptoms of the common cold or coronavirus or the flu, they're all the same, right? You can't clinically distinguish between that. So the answer to your question is yes. Get seen on a video visit. Make sure that you're not so ill that you need an in-person visit, right? And then make sure your provider is ordering that testing and that you're isolating until the period when you don't need to isolate anymore for that. That is absolutely critical for our country to get that right. At Asante, we're doing everything we can to support that in our local community.
That's wonderful. That's awesome. Scott, I'm curious to know, what are your thoughts about the timeline for an effective vaccine? Have you been thinking about this? I know
I have
we've been
every day.
asked
We
this
just
question
talked.
a million times.
Yes, yes.
And
You
we've
know,
talked
I do
about
think,
it.
yeah, exactly. We've talked about it frequently, and I talk about it with Dr. Grebosky quite often. Because you're right. I think people are getting tired of living like this, and the unfortunate reality is, I think it's just going to be a little bit longer. I do think we may have a vaccine in December. Whether it will be effective or not, who knows? Jamie may have a different feel, but I think we're probably going to be living like this through at least the spring, of social distancing, and we're going to have to see that vaccine coming out. We just have to see if it's effective.
Mm.
You know,
And
I'm not one of those people that think it's going to be
and
3
once it
years.
is, once it is clarified effective, do you see everyone being able to access that? There may be.
I think access is going to be a challenge because they're going to have to produce enough of that vaccine. So that'll be a challenge. And then we'll have to convince people to take it and get them to take it. And so that'll all be challenges of us going forward.
Yeah, just a few comments about that. I have faith and confidence in our agencies that we'll have, a safe and effective vaccine. And, the processes we're using this year are a bit different for other vaccines. And I get that, right? It's a contingency plan because we're in the middle of a 100-year pandemic that we haven't seen. So there's that tiny bit of caution that I think we need to take as well. To your point about access, Tiffany, already the feds are asking states to develop local plans around use of the vaccine. You may have seen the other day, there was a broad outline around the 4 tiers of access to a vaccine, starting with healthcare workers and at-risk patients, and then moving to critical infrastructure workers, those sorts of things. So, I am hopeful that we'll have a clear plan and that we'll, utilize vaccines safely and effectively. And likely what'll happen is we'll find out that some vaccines are more effective than others, and then we'll have to put more resources into getting that. But again, it's to my point before, we're a bit in uncharted waters right now, and we're trying to navigate through this as best we can.
Well, I've been watching this pretty closely about what to expect from a vaccine, and what I'm hearing is it's probably going to be a more temporary vaccine. It won't be permanent, right? So, we're talking maybe 3 months worth of protection or a little bit more. I think there's a lot of unknown. And then there is other information that's coming out that, that says, yes, this vaccine may be effective, but it may be you may still exhibit symptoms. So you may still get it. It's just going to be sort of a more mild case. What is your feeling about what to expect from a vaccine? How impactful will that really be?
So one of the cut points that has been made public is that agencies won't approve a vaccine that is thought to be less than 50% effective.
Okay.
So that's one. To the point about how long it lasts for, yes, it may be that you need booster shots or more than one shot a year, sort of thing, depending on how effective it is and how long the immunity lasts. And, as we see with the flu, people may get what we call an attenuated case of illness. That is, they still contract the illness, but it's a less severe form of the illness. So somebody may still get COVID, but rather than requiring intubation and 20 days of care in a critical care unit, they may be less ill and may not even require hospitalization. So that's our hope, that not only do we tamp down the serious cases, we also tamp down the absolute number of cases with an immunization.
So this, yes, Scott, you wanted to say something, piggyback off of this?
Well, it was just I just wanted to piggyback off that a little bit and just say that, I think in our community, I'm very proud. Jamie and I, we co-chair Incident Command together. And so the way that our nursing staff, the lab, the pharmacy, nursing up the operations of the facility. I mean, everybody has really risen to this occasion, but we are definitely not out of the woods. So we're just going to have to continue and try to figure out how to get through the fall together. And it's going to take all of us working together. Jamie said the community has their part, we have our part, and everyone has to do their piece.
Well, that's a good part, which leads me to this question, and this is for both of you, as we're heading into the fall and winter. As we head into the cold flu season, is there anything you want to make sure people are aware of when it comes to seeking care? I mean, especially if you're going into the hospital and you think that you might have the regular flu, the annual flu, versus the COVID,
Right.
you know, in terms of symptoms. Is there anything that we need to, how we can prepare ourselves going forward?
Dr. Grebosky, I'll let you.
I think
Yep.
you know, what we want to avoid is a twin-demic. We don't want to have a pandemic flu along with COVID. So I think preparation for all appropriate individuals, get an influenza shot this year. That's really important because that will help quite a bit, not only with you as an individual, but our community at large. I think that's a critical piece. Now, a bit of good news, what we've seen in the Southern Hemisphere is that their influenza season has not been very severe this year. We think because of the physical distancing measures, which is the way influenza spreads, the same way as COVID, that that's had an impact. So it's our hope that we don't have a bad influenza season, and we know that the community can impact that by high rates of adopting influenza immunization and continuing the physical distancing things we're doing, hand hygiene, all those sorts of things you're aware of.
And Scott, you like to comment?
You know, I would agree. I think it's not complex, but it does require discipline. So it's just what Jamie said. I think it's the vaccination. I think it's the hand hygiene. I think it's the social distancing. I think it's the masking. It's the stuff that people are getting tired of doing, but they need to continue to do it. It's prudent.
So with respect to the flu vaccine and whatnot, I know there's recommendations, you know, people who are vulnerable, elderly, kids in some instances. Is that recommendation kind of broadening to include people of all ages, or what is your feeling on who should move forward with the flu vaccine?
Yeah, that's exactly right. The flu immunization is appropriate for most people. You know, certainly if you're allergic to it, a very small infants, it's not appropriate for them in most cases, but the vast majority of people are appropriate for a flu immunization and should be getting a flu immunization and speaking with their provider about that.
Statistically, is that something that's been sort of broadly rolled out here? I mean, do most people get a flu vaccine in the Rogue Valley?
Unfortunately not. I'm not familiar with our specific numbers, but nationally and typically every time you look at it, it's in the high 40s% of individuals who get the flu immunization annually. And so increasing that penetrance in our population helps everyone, helps tamp down flu, it helps provide herd immunity and those sorts of things.
And so why do you think a lot of people don't get it? I know I've been one that didn't get one every season.
I don't get one either.
Get one. You know, I fall in that category of not always get. I know why I didn't always get one, but what do you think the reason is for most people? Just
I think
laziness?
That's complex and multifactorial. I don't think it has anything to do with laziness. I think it has to do with people don't perceive the benefit of it appropriately. I think vaccine hesitancy has a lot of reasons. I think there's been a lot of dis and misinformation that have been provided about the safety and effectiveness of the immunizations out there, and it's hard to overcome that in society at large. So I'd just encourage people to work with their providers and to work with others that they trust for good sources of information to look at this and to get it, and they'll see that it's right for most people.
And there's a small percentage of people I know that might be allergic to shots here and there, but
Yeah, there are certain components of the way the immunization is derived that they may be allergic to, and there's things we can do to mitigate that or to help with that. They should work with their provider on that. If that's
great. Well, I'd love to thank you both, Scott and Jamie, for taking the time to discuss such an important topic. You know, Jessica and I, we learned so much, and I'm sure our viewers have gained just a wealth of knowledge. Remember to tune in to Rogue Voice online every Thursday at 4 p.m. Pacific Standard Time, and connect with us on our YouTube channel and Facebook, where you can send us a message or leave a comment. We want to hear from you. So tune in. Thank you, and we look forward to seeing you next time.
Thank you.
Thank you.